And welcome to today's webinar. For those who are joining us for the very first time, my name is Alina Bonadonna, and I'm super happy to be a moderator for this session. And as usual, it's already like a very good tendency to host just the brilliant speakers, the best professionals in the industry. And today we are joined by Dr. Byron Chaves, an esteemed associate professor at University of Nebraska. How are you, Byron?
I'm doing really well. How are you this afternoon for you?
Yeah, for me, it's also very fine. And I'm so happy to see you the second time joining our academy.
Absolutely.
Great.
Thanks for having me.
Thank you for joining us. And guys, as always, my question to you, do you see us well? Do you hear us well? Just drop some reactions with a heart, claps, likes, whatever. You know where it is. It's on the left corner. And so far, people are maybe a bit shy. So we see only one, two. Okay. Now I'm calm. Now I'm calm. So, guys, as always, we will have like around 40 minutes of slide deck from Byron, then followed up with a QA session from you guys. So don't hesitate to ask a lot of tricky questions. And at the end, don't be in rush to quit our session because we prepared something very special to everyone. And yeah, if Byron is ready, let's start.
Absolutely. So let me share my screen. And Alina, you can tell me if you see the right thing on the screen.
Not yet with
Okay.
speakers. Yeah, now it's
Yeah.
fine. Perfect.
Okay. So everything is good?
Yes.
Okay, great. Well, good morning, afternoon, evening, everybody. Like Alina said, my name is Byron Chaves. I'm an associate professor here at the University of Nebraska-Lincoln. For a couple more days, I'm actually transitioning to another university, and Friday is my last day at the University of Nebraska, but you can find me at Rutgers University starting in a couple of weeks. So the purpose of today's talk is to discuss a little bit about hazard analysis. And of course, you guys work in industry, you are somewhat familiar with hazard analysis. And maybe it is your job to even do hazard analysis and develop food safety plans or HACCP plans, okay? Now, the goal of today is to talk a little bit more about what is the support for hazard analysis. What are some things that we should be doing when it comes to justifying our decisions at selecting hazards and so forth, okay? So the title of this talk, it's using real data to strengthen principle one. And as I was preparing this presentation last night, don't judge me, I'm trying to move cross country, so I've been really busy. But as I was preparing this presentation, I was thinking, well, real data, it's really not the best descriptor because everything is real data, right? I mean, unless you made it up, but let's say that everything is real data. But what I really mean by real data here is what is the correct data that we should be using to justify our decisions. So hopefully today we're going to get some clarity on that. I'm going to talk for about 35 minutes and then we'll have plenty of time for questions. Okay, the very first thing that I want to clarify is what is this difference between hazard and risk, which still in industry people tend to use interchangeably, but they are not the same thing, right? When we think about a hazard, this is the physical, chemical, or biological agent capable of causing illness or injury in the consumer when we do not apply a control, right? So think about things like salmonella, or maybe glass, or maybe mycotoxins. If we don't apply controls in the food chain or in the food supply, then those can actually cause illness or injury. Now, what we want to do with hazards is control them, reduce them, or eliminate them. And you are probably familiar with HACCP, and so you know these terms. Now, in most cases, we cannot fully eliminate a hazard, but we can either control it or reduce it to an acceptable level in a way that we can manage the risk. And so then that takes us to the concept of risk, which, as you see on the screen, is a probability function of the incidence of occurrence of a hazard and the severity of the illness caused by that hazard. Basically, risk is what are the chances that that hazard is going to make somebody sick, right? In really plain terms, that's basically what we mean, so that we can start managing that risk, right? So quantitatively reducing that risk. And what we want to do is to minimize it. It's to make it as small as possible, but it is likely that we're never going to have a zero risk system for a number of reasons, but mostly statistically, it's very, very difficult to get that number to zero. We can make it very close to zero, but we can't really make it zero. So again, hazard is the agent and risk is the probability that that agent will make somebody sick. Okay, now continuing with things that you already know, but I wanted to remind you or refresh, we have the concept of HACCP, right? And HACCP is the Hazard Analysis and Critical Control Point System, is the universal language of food safety. Everybody in the world uses HACCP to different extents, but everybody kind of has this global understanding of HACCP as a universal food safety management system. And what we mean by food safety management systems is really a system that it's going to make food safety principles operational. If the food safety principle is that you have to minimize the risk associated with a physical hazard, then how do we actually make that happen, right? And it is by applying this type of methodological, preventive, and science-based systems. So the way that we define HACCP is a systematic approach to evaluating, identifying, and controlling food safety hazards, whether those are physical, chemical, or biological. Now, again, this is a system designed to minimize the risk associated with food safety hazards, but it is not a zero risk system because, again, we live in a statistical world, right? So it's all about statistics and probability. And when we think about the food chain and the food supply, we rely heavily on sampling and testing. And that sampling and testing, it's going to tell us with a certain level of confidence whether a lot or a batch of product is free from a defect, let's say from a food safety hazard. But we can't really test every single unit of product because most of the testing that we have is actually destructive, right? We do have some non-destructive testing, but we rely on collecting a sample and then making inferences on the population just using that one sample. So statistically, very difficult to make it zero. Now, the HACCP approach emphasizes process control, right? This is basically maintaining the output of a specific process within a desired range. This is really cool, right? Because this is what actually tells us, okay, this is the number of defects that I can accept in a specific lot, right? Or these are the characteristics of the product that I'm willing to accept when I receive a batch of product. So if the process is out of control, then there is an increased probability that a food safety hazard will happen. And if there's an increased probability that the hazard can happen, then of course, the risk increases, okay? So the HACCP system really concentrates on points of the process that are critical to manage the risk. And that is what ultimately we end up calling a CCP, right? A critical control point in HACCP terminology would be a step in the process that effectively manages and minimizes the risk associated with the hazards that we have identified. Now, that point is critical, right? We can only manage the risk of the hazards that we have identified. And if we don't identify the hazards adequately, then we may not be applying the right controls. So that takes us, of course, to the concept of hazard analysis. As you know, these are the 7 principles of HACCP, from conducting a hazard analysis to establishing record keeping and documentation procedures. Now, HACCP principles don't work in isolation, right? They are all actually connected. Now, the way that we teach HACCP and that we design HACCP plans, it's typically by looking at individual principles, right? But they are all, of course, interconnected because this is a comprehensive system. Now, conducting a hazard analysis is, of course, principle number 1, and this is the cornerstone of modern food safety management systems. Like I said, we cannot manage the risk associated with hazards that we have not identified. So the hazard analysis then becomes the foundation for all downstream food safety decisions, right? We identify the hazards and we apply controls for those hazards. everybody's happy, we're minimizing the risk, and our food safety system becomes stronger and stronger. But if we do not identify the correct hazards, then it will be very difficult to have a safe food supply. And then, of course, across frameworks, whether that is Codex or whether that is the USDA FSIS or maybe the US FDA, whatever regulation we're thinking about, a solid food safety management system really starts with conducting a hazard analysis. Now, the other foundational aspect to any food safety management system, including HACCP, is of course what you guys already know as prerequisite programs. Okay. Now, prerequisite programs would be things like sanitation, environmental sanitation, good manufacturing practices, supplier controls, supplier specifications, lots of different things that we can call prerequisite programs, things that we need to do before we implement a HACCP plan so that that HACCP plan is actually effective at minimizing the risk associated with the hazards that we have identified. Now, one of the main issues that we have in food safety management systems, particularly for small and very small or medium companies, is the over-reliance on prerequisite programs. So we tend to say, okay, we're going to manage that using a prerequisite program, but then that prerequisite program may not be adequately validated, right? So just keep in mind that just because you're trying to manage a hazard using a prerequisite program and not included in your HACCP plan doesn't mean that that hazard is going to be managed by itself, right? You still have to have a system of validated and adequately monitored prerequisite programs. Now, the other big big component here is the preliminary steps of HACCP, which go from creating the team to identifying all of the ingredients and the processes, right? The flow diagram, all of those things become critical when we are assessing hazards, right? And conducting the hazard analysis. So those preliminary steps that we typically identify as the 5 preliminary steps are critical to conducting a correct hazard analysis. We see a lot of times when I work with industry, which is all the time, I work closely with industry on a daily basis, but we see we ask people, what is the pH of your product? What is the water activity of your product? Tell me the full composition. And a lot of companies don't have that information, right? Or a lot of teams don't have that information. And those aspects are critical because we want to know everything that goes into that product so that we can make assessments about individual ingredients. And that actually takes us to a component that we'll talk about later, which is ingredient hazard analysis versus process hazard analysis. Now, at this point, I'm going to remind you the definition of hazard and risk, right? So a hazard is the agent that can cause illness or injury in the absence of its control, and risk is basically what are the chances that in the absence of control, that hazard will cause illness or injury in the consumer. And so these two terms are highly related as well, but they are not the same, right? So hazard analysis versus risk assessment. We tend to also use this somewhat interchangeably in industry, and they are not really the same. And so it is best to define them separately. A hazard analysis is a facility, process, and product-specific evaluation, okay? So facilities, right? Because facilities have different layouts, may have different ages, right? So maybe a facility is really new, another one might be really old. Processes, right? So it's not the same to process something thermally than non-thermally. And then, of course, product, because the matrix has an effect on the hazards. So we do facility, process, and product-specific evaluations, and the output is the hazards that require operational controls. So which ones are the hazards that we actually need to manage, right? Of all the hazards that exist, which ones are the ones that are likely to happen in my product and process? And then we have another aspect, which is the risk assessment. And this is the science-based process of estimating the likelihood and severity of adverse health effects in a population resulting from exposure to the hazard, right? So this is the more maybe quantitative aspect of food safety management system. And the output is going to be a risk characterization that will inform guidance and strategy. Now, that risk characterization, right, could be a number. Ideally, if we're doing a quantitative risk assessment, We could have very specific situations where we can do a quantitative risk assessment if we have the right inputs, if we have the right data. But for most people, that is unrealistic, right? And also for most people, that is unnecessary. We can continue to do qualitative risk assessments in industry that will continue to inform hazard analysis. So again, just like hazard is not the same as risk, hazard analysis and risk assessment are not the same thing. Now, facilities are not expected to perform formal risk assessments, right? We can certainly do them, and that will inform hazard analysis, but they are not required to do that. And hazard analysis is at the end of the day not just a numerical risk scoring, which is also something that we see in industry, and some of those deficiencies that we see in HACCP and food safety plans is to say, well, of these 10 hazards that I identified, these are the top 3 hazards, right? And people will call that a hazard analysis. There is a risk ranking or risk scoring, and it is important because it definitely helps us allocate resources and technical expertise and stuff like that. But the hazard analysis is not just listing the hazards and then doing a little bit of risk scoring. It definitely requires more than that. Okay, let me take a look at the time here and see how we're doing. Alina, any questions, any comments? As you guys come up with your questions and comments, please type them in the chat, and Alina will take care of those later.
Yeah. So far, we are fine. Everyone is super focused.
Okay, great. Yeah, I love it. Hopefully, you guys will have some questions then later. Okay. Now, when it comes to integrating that risk assessment with hazard analysis, the 2 main aspects that we want to evaluate is the likelihood of occurrence of the hazard. How likely is it that I'm going to find that hazard in my product and process combination, right? So remember, product and process go hand in hand with the hazards, right? Like sometimes we cannot really generalize so much because each product and process, it's different. So when we think about likelihood of a hazard, we look at historical data, we look at baselines that may be published, we look at surveillance results, whether it is from a government agency or maybe from scientific publications, and we look at context, okay? Context really matters when we're thinking about likelihood of occurrence. The likelihood of occurrence goes beyond testing. When we think about testing and you're working with your testing companies, right? You are working with, I'm not going to tell you the names of any testing companies, but you are working with a testing company. You have to really think about what is the matrix, what are the chances that you're really going to find that hazard in that matrix? What is the analytical capability of that specific equipment or specific lab that you're sending your samples to, right? So all of those things have to be put in context because some matrices are really difficult to test. Let's say, spices. I'll have a case for spices later. I'm going to tell you a little bit of spices using an example. But there are some matrices that are particularly difficult to test for a specific hazard. And so you need to work with a lab that actually has the capabilities to be able to find that. Now, even if they do have the capabilities, you may not be collecting the right number of samples. And so that is when we resort to things like microbiological indicators for process control and lots of more information that you can use to inform decision making. But in any case, the likelihood of occurrence could go from almost certain that it's going to happen to something that it's rare, right? Now, this is where we think if our prerequisite programs are really good, then it is unlikely that a hazard is going to happen, right? So we start thinking about those sorts of things. Let's say in meat and poultry products, we have rarely seen anything like norovirus, right? Because if we follow good manufacturing practices, then it is almost certain, it is extremely rare that we're going to see something like norovirus in a processed meat product, right? So we start relying on prerequisite programs then to determine likelihood. Now, I'll go back here for a second, and I ask this question all the time when I'm teaching HACCP, especially for meat and poultry processors, but I always ask the question, if we go around and collect 100 carcasses, chicken carcasses, raw, from around town, and then we bring them to my lab, how many of those 100 carcasses do you think are going to have salmonella? And people will say a variety of things, right? But people will say 100%. A lot of people will say 100%. And the reality is that if 100% of chicken carcasses tested positive for salmonella, we would have many, many, many more people getting sick with salmonella, right? So we typically would say 3 to 5 of those carcasses, or maybe 2 to 5 of those carcasses, are going to be salmonella positive. But at the end of the day, it's a matter of probability. It's not too many carcasses, but we produce millions of carcasses. So a few million within millions of carcasses, it's still a lot of product that it's potentially contaminated. So we tend to overestimate the likelihood of a hazard. And on the other side, we tend to underestimate the severity of a hazard. We tend to think, well, it's just, stomach bug, or it's just an illness that lasts 2 days. But it's not an illness that lasts 2 days for many people. And that is why people continue, of course, to die from foodborne illness. So the severity of the hazard can go from insignificant to catastrophic. And this could be from a public health perspective, right? Or it could be from a financial perspective. It could be from a public relations perspective, right? So when we are thinking of assessing the risk and the consequences, that is not just the consequences for the consumer, but also the consequences for the company. Are you going to go bankrupt? It's basically the question. If this hazard gets out of control, of course, there's public health consequences, but what are the consequences from an insurance, from a financial perspective, and stuff like that? And so that also comes into play when we are thinking about the severity of the hazard, short-term consequences as well as long-term consequences. And then we start putting all of these things together, right? We start putting this into qualitative risk rankings, and we typically end up with something like this, where hazards that carry a low to moderate level of risk are managed through prerequisite programs, including GMPs, supplier controls, many other things that you guys use in industry. And then the hazards that carry a high or very high risk then are typically managed directly using HACCP or preventive control approaches. This is typically the fine line that we have. Now, it's not always black and white, right? There are some hazards that carry a really, really high level of risk. Let's say Listeria monocytogenes in ready-to-eat foods. And so some people do manage Listeria almost as a prerequisite program with an environmental monitoring program, right? They sometimes call it a prerequisite program. Lots of different things can be managed with a prerequisite program. Some of those hazards that carry a high level of risk, we may want to manage separately, like the case of Listeria monocytogenes, in use in environmental monitoring programs as a verification activity that your sanitation controls are actually effective, right? So when we think about this, don't get too stuck up with the terminology. We do need to understand the terminology, particularly because inspectors and auditors may be used to specific terminology. But as long as you can demonstrate that you are managing the risk effectively and that you have identified the hazards adequately, then you have a defensible food safety or HACCP plan. Okay, so moving on here, this is a table or a similar table that you have probably seen many times if you have taken a HACCP course, or a similar food safety plan or preventive controls for human foods regulation if you are in the US. Now, outside of the US, you have typically seen something like this for HACCP. We have for each ingredient or process step, we identify potential hazards that are introduced, enhanced, or controlled at that one step. And then we have to determine whether that hazard is reasonably likely to occur and justify whether that is a yes or whether that is a no. We still have to justify. If we do say yes, of course, we have to find controls. And those controls will be steps in the process that effectively minimize the risk associated with those hazards. This can get complicated fairly quickly, right? Because we either over rely on good manufacturing practices and other prerequisite programs, or we start saying that everything is reasonably likely to happen, and then our HACCP plan becomes overwhelmingly big and complicated, right? So that is when the risk ranking and the risk assessment actually do come in to help us determine which hazards are likely to happen. of all the hazards that exist, which ones are actually likely to happen. So again, keep this table in mind that you have probably seen before, and think about a time when you have done hazard analysis or implemented hazard analysis and hazard plans in your operations, right? And how did you approach that hazard analysis? Did you mostly approach it from an ingredient perspective, or did you mostly approach it from a process perspective, right? Those are different things that we are about to define. Alina, any comments or questions?
Not yet, not yet.
Okay. Okay, everybody's so quiet today, but we'll get to some examples here in a bit, and hopefully you guys will have some comments. Okay, so when we think about hazard analysis, we can approach this from two perspectives. We can do it from an ingredient perspective, in which we evaluate hazards that are inherent to the raw materials and ingredients, and then we determine whether those hazards are reasonably likely to enter the food supply, independent of how we are going to control them later. So basically, this is assessing what are the hazards that can come in my ingredients and supplies. Okay, that's basically what we're trying to determine. And then we have process hazards, which we evaluate how they may be introduced, enhanced, or controlled by manufacturing activities or conditions as the product moves through the line at each step of the process. And we have typically, for hazard purposes, we have typically relied a lot or done a lot of process hazard analysis, right? And we have somewhat forgotten the ingredient hazard analysis. And so at the end of the day, the best practice is to do these two things separately and then start combining the hazard analysis aspects. But I have four case studies or four scenarios that I'm going to show you here in a minute, and then hopefully these things will become a little more clear or relevant to your operations. Okay, I had mentioned that I had a case on salmonella in spices. This is a beautiful case study that I use all the time. But basically, with salmonella in spices, the hazard identification aspect here would be that spices are a reasonable vehicle for salmonella, right? We know that from different sources, and people have gotten sick and whatnot. Typically, when we do the hazard evaluation, we have to consider the severity and the likelihood, of course. So the severity in this case, moderate to high. We know that salmonella is a self-limiting infection for most healthy adults, but that it is likely to cause a little more complications in children, in older adults, maybe in immunocompromised patients, right? So we know that for the majority of the population, the severity is moderate, okay? Now, the likelihood of occurrence has to be put in context. The likelihood of occurrence for this case would be only salmonella in spices, and it's not in all spices. Let's just assume that this is black pepper. So salmonella in black pepper, extremely low levels of contamination, right? So we bring the spices, we buy them, and then we test them, and we collect a lot of samples, and we can't find the salmonella, right? So there are two aspects of that. One is that contamination in low moisture foods or low moisture ingredients tends to be sporadic and very heterogeneously distributed, as well as difficult to detect with routine sampling. That is where working with your testing company and your testing laboratories is going to be really beneficial, right? To say, hey, yeah, these are the chances that we're going to find it with the methods that we use. Why don't we rely a little bit more on maybe microbiological indicators as for process control, so that we know that our characteristics may not allow the presence of a pathogen or something like that. Of course, we can't really predict pathogen presence with microbiological indicators, but those indicators can tell you a lot about the microbial quality of that product. So anyway, these ones are hard to get, right? So just because the prevalence is really low doesn't mean that the risk is already managed. In this process, spices are added post-lethality, right? So let's say that we have spices that we can put on ready-to-eat food products. There's no downstream kill step, and any rare contamination event, therefore, becomes a finished product event, right? So we don't want that. We don't want the consumer to get sick by sparkling a little bit of black pepper onto their sandwich, right? So that is a big no. Now, what do we mean by data, right? When we think about what data is supporting this decision, well, the prevalence data, if we rely only on prevalence data, we wouldn't consider this a hazard reasonably likely to happen because the prevalence of salmonella in spices is low. But we do have data from outbreak investigations and epidemiological data that tell us, yeah, people actually do get sick with salmonella in spices, right? Despite the fact that salmonella is not actively growing because the product has a very low or relatively low water activity. So what is the data that matters in this case? Outbreak investigations, recall and enforcement data, survival and persistence literature, right? Knowing that salmonella can survive in low water activity foods for many, many months. And then, of course, relying much more on supplier validation records that in this case, the black pepper has been treated for safety with a validated lethality step in which the microbe is expected to be eliminated at a 99.999%. Okay, in the absence of a validated in-house lethality step, then we have to rely on a supply chain preventive control, right? We have to communicate very clearly with the supplier, do supplier approvals and validated treatment documentation, as well as verification activities that may or may not include testing. If testing doesn't make sense as a verification activity because the prevalence is so low, then maybe that verification activity should be something else. Now, the decision is driven by process context and public health evidence rather than the prevalence alone, right? These things are important because at the end of the day, you have to justify your decisions in how you spend the money, right? You have to go to your CEOs and your, your company owners and justify the way that you do decisions, that you make decisions in the money that you spend. And this is typically the way that we want to start justifying from a public health perspective. Okay, let me go to a different example here. This is another microbe. This is Clostridium perfringens in processed meats. Okay. Now, Clostridium perfringens is a spore-forming organism, so it is different than Salmonella. Okay. Salmonella does not produce spores, but it has other mechanisms that allow it to survive. In the case of Clostridium perfringens, cooling, right? So the cooling of a food product after it has been cooked is identified as a process step where the spores can survive and then can germinate if there is some kind of time temperature abuse, right? If there is a temperature abuse process during cooling. So the severity, again, we typically consider this to be moderate to high, right? Because for most of the population, for the general population, it is not particularly dangerous, right? But for some segments of the population can become pretty dangerous. Now, let me tell you something. I am almost certain that I've had Clostridium perfringens before, and it is not fun. Okay, now the likelihood of this hazard happening in my product and process combination needs to be done in context. Again, just like everything else, we need context for the way that we identify severity and likelihood. Now, the likelihood here was done comparing conventional versus clean label ingredients, right? So when we think about conventional, that would be using nitrites, right, or curing salts. So you are producing a product, a processed meat product, and you want to change formulation. In this case, there's not a lot of information of what happens to this microbe when we change formulations. So we go to things like COM-base, right, which are microbiological predictive public models, and use their perfringens predictor. And it turns out that that predictor overestimated the growth compared to what you got from challenge studies that were done at a university or at a private testing lab. So in this context, reformulating with no nitrate ingredients may change microbial behavior during thermal stabilization, but if we rely heavily on those microbiological predictive models to determine what is the likelihood of occurrence of a hazard, we may be heavily overestimating that, right? So in this case, what do we do? What is the data that we have to present to support the hazard analysis decision that we have done? Well, the predictive microbiological models are great, right? And we use them all the time. My research particularly is on mathematical predictive modeling. So I'm very in favor of doing that because it can be very helpful. But in some circumstances, lacking context, it doesn't really tell you anything, right? So in this case, product-specific challenge studies would be more valuable. In-plant cooling curves, right? So that you can submit that to a process authority that can tell you, yeah, these are the chances that the microbe is going to outgrow to a level of public health concern. Maybe deviation and hold records, right? Deviation and product holding records would be more valuable. So again, in this case, predictive models overestimated the growth for the new formulation that the company was trying to establish. So product-specific data showed lower outgrowth. Cooling then remains a process preventive control, or a CCP, if you are working in the meat industry, with the limits grounded in empirical validation rather than on using models, right? So again, all of these things need to be put in context. I cannot really give you examples of all possible scenarios because we have virtually an infinite number of product and process combinations and product, process, and hazard combinations. But this is just to give you an idea of how do we actually justify, what is the data that we need to use to justify our decision making. Okay, scenario number 3. In this case, this is a different type of matrix, but we also have another spore-forming organism. This is Bacillus cereus. Many of you have probably heard of these microbes before. So in this scenario, we have cooked rice that it's used in ready-to-eat meals, right? So where I'm from, in Costa Rica, we eat a lot of mixes of rice with chicken or rice with beans or rice with anything. And we can buy that at the store, right? You go and buy pre-packaged meals. The other place where we see this very frequently is in airline caterers, right? So airline caterers will buy, of course, rice, and then that rice needs to be cooked so that it goes into meals that are going to be served on a plane. Now, in this case, what I wanted to show you, it's doing ingredient hazard analysis versus process hazard analysis. So let's get to it. So the ingredient hazard analysis, we identify Bacillus cereus that may be present in dry rice, even though they may be present at very low levels, right? So we typically encounter spores of that microbe. Now, the severity, it's moderate, right? When we get an intoxication with Bacillus cereus, when the toxin is produced in the product and we get sick, it's typically, again, for most adult people, population, healthy population, it's not particularly severe, but it can get pretty severe, right? And we have seen cases of Bacillus cereus intoxication that have gone terribly wrong. And so maybe you guys have heard of the person that presumably lost all of their limbs, right? So arms and legs because they ate, I want to say, rice that they left on the counter for several days. And so the amount of toxin that they consumed was just, astronomical, right? So there were some pretty unusual consequences there. Now, in this case, when we do ingredient hazard analysis, we identified that the dry rice may be contaminated with spores of Bacillus cereus, but there's no preventive control other than supplier approval, right? And GMPs, so that we are not introducing any more spores into that product. However, once we hydrate that rice and we cook it, then the conditions are such that germination can happen. And if the product is not adequately cooled, then it can produce toxin, right? The microbe can produce a toxin. That toxin is heat stable. So even if you reheat that product, the toxin is not going to be destroyed. And in this case, the hazard then is driven by it's not driven by the ingredient, but by the time temperature abuse during processing. And so we need to separate these two things, right? We can say ingredients, sure, we're going to have some level of spores, but the initial level of spores in itself doesn't really carry a high level of risk because the product is dry. It is really at the point of rehydrating and then cooling that product down after we cook it, that the hazard can actually represent a risk. Okay, so the question here is, does dried rice inherently present a significant biological hazard? The answer is no. The question from a process perspective is, can your process allow spores to germinate and produce a toxin and then potentially cause illness? The answer is yes. At the end of the day, we do apply controls at some point. And then the last case that I have is one that I encountered recently, which is mycotoxins in cricket powder. Of course, not everybody's using cricket powder. It's one of those novel foods that people are starting to use, but it is used in many areas of the world. Now, cricket powder can be contaminated with many things, including salmonella, bacillus cereus, and whatnot, but mycotoxins is a particular concern, especially when we start producing cricket powder at larger scales and storing those in conditions that may be adequate or leading to fungal growth and potential production of mycotoxins. So cricket powder may contain mycotoxins originating from contaminated feed that is fed to the crickets, right, when they are alive. These toxins are heat stable and survive drying or roasting. So after we dry or roast the crickets, the mycotoxin may still be present in those tissues. And so severity is high due to chronic toxicity and low regulatory limits. The hazard is reasonably likely to happen at receiving and inherent to the supply chain, right? So we may expect that cricket powder will have some level of mycotoxin residue. Now, from a process hazard analysis, there's really not much that we can do, right? So at this point, manufacturing steps do not destroy the mycotoxin if the mycotoxin is present, and the process does not introduce a hazard, but the hazard comes inherently with the ingredient, right? Which is the opposite to what we saw in the rice example that I just gave you. So in this case, what mattered the most is an ingredient hazard analysis that will identify that, okay, mycotoxins can come in here. We can do verification testing. We can do other things, but really what matters is a supply chain control, because the process in itself will not introduce, enhance, or control that hazard. And so with that, the takeaway, so that we can have some time for questions, is that hazard analysis really depends on context. Now, I'll give you just a super quick example. I went to do an audit one time in Honduras, and I was auditing a facility where I disagreed heavily with the hazards that had been identified. And so basically the food safety team said, okay, we'll just eliminate those hazards from our hazard analysis, right? And I said, okay, well, that's not exactly how it's done, right? Even if you disagree with the auditor or with an inspector, you still have to go through a process of reassessment and reanalyze your hazard and reanalyze your hazards, right? So it's not a decision that can just be made like that. So hazard analysis has to go in context. Now, remember that low prevalence does not equal low risk, right? So again, it depends on context. Many of the foods that we consume that are associated with specific hazards, if you go and collect thousands of samples of that food product, it's going to turn back negative for that hazard, right? So ingredient hazards and process hazards must be evaluated separately, and we can still use predictive models, but they have to be confirmed with product-specific data, especially for novel foods or novel antimicrobial interventions. Any supplier changes and formulation changes trigger reanalysis. This was very clear last year when we had lots of instances of the radioactive shrimp here in the US, and that shrimp was coming from Southeast Asia, right? So even though the likelihood of somebody getting sick with cesium was extremely low, you don't want to sell that product, right? Because from a PR perspective, that product was already destined to fail. So in that case, even if you change suppliers or stuff like that, you have to consider that in context. Is there radiological contamination in all Southeast Asia where I could potentially source that product, right? So there's also geographical considerations. And then again, let's focus on reasonably foreseeable hazards, not on every possibility, because otherwise our food safety systems would become overwhelmed. So with that, Alina, that's all I have for today, and I would be happy to take any questions.
Actually, there are some, but first of all, I would love to encourage everyone to drop some reaction, just saying thanks for this amazing presentation, because there were a lot of important data shared, a lot of really valuable insights. So Byron, you have to, oh, now you see it. Now you see this bunch
Good.
of reactions, yes. So how do you feel? Should we tell the secret now, or you are muted for now? Okay.
Totally. No, totally. Go for it. I'll
Okay.
drink some coffee while you do the announcement.
Okay. So guys, like drum should be like doing some sounds, blah blah blah. But if you liked this presentation, and I'm sure you did, we are arranging a 2 days course specifically for practical hazard analysis for Stroner food safety systems. And this course will be mainly, unfortunately, for those who are based in US, Canada, Latin America, considering the time zone. So this course will be led by Byron, and exclusively for those who spend this amazing, already almost 1 hour, listening to slides and getting more and more information. We are offering also a promo code to get 20% discount and to be the first who sign up and get the free spot, because we have only 10, 12, 10, right? How many people we have? Yeah, only 10 available slots. You're
Yeah.
again muted.
Yeah, I think it was 12. I think it was 12.
Yeah, yeah. So don't miss the opportunity. And I'm quickly jumping back to the question section. The first comment I would love to read out loud, because it was related to your slides. Actually, you mentioned it, you answered already this question, but still, in Canada, it is common for us to do a double analysis where we do hazard analysis, Form 5A, for all incoming ingredients, packaging materials, and processing aids. And then a secondary hazard analysis for the processing steps and cross-contamination locations, Form 5B.
Mhm.
So that's something you mentioned actually in your
Yeah.
slides.
Yeah, and if I can just follow up with that, yeah, I mean, I think that that is a great approach, right? So you first identify anything that could potentially come in, and then you determine if any of those hazards can be introduced in hazard control during the process step, and what are, recontamination, like the person mentioned, recontamination and cross contamination activities are typically ignored or forgotten in the process hazard analysis, right? So yeah, so that is a really good point.
Yeah. Then the next question, is there any other standard table like the one you shared? I think it was fifth slide or something like this.
Mhm. Yeah, I mean, you can make it whatever you want. At the end of the day, codex. If you go to the codex tables, which is very similar to what I showed, it is the more standard one, and I would advise not to change it too much. I mean, internally for companies, you can do whatever you want, but auditors and inspectors tend to be very familiar with those specific sets of tables, right? So you still want to make it easier for people to understand your own data.
Yeah. And can you also maybe share share more information about OPRP determination? That was a question.
Yeah, so OPRP, do you mean operational prerequisites? Is that what they mean?
Probably,
Um,
yeah.
yeah. So I mean, it will just depend on the context again. I don't I I don't know exactly how to respond that question, because when we think about um, operationally what is managing the risk, I think I would need to know a little more information. So if that person's still here, can retype something, give me more meat so that I can respond.
Yeah, yeah. Then look, there are three comments related to your upcoming course. The last one, for example, I recommend Byron's training session from Dominic Wall.
Oh, good. Thank you so much. Yeah.
Yeah. So, guys, you should not have doubts now if it's the right person to attend his course or not. Of course, he is the best one. So, next question. How can smaller plants with a simple monitoring tools apply a data-driven approach to hazard analysis effectively?
Yeah, I would say, if you are in the US, talk to an extension specialist like myself or many other extension specialists at your local state university. If you are outside of the US, you can still reach out to us, right? So I think that the whole point is what is the data that it's giving you the most information for your money, right? We see a lot of microbiological indicator data that it's not giving you anything. Maybe your matrix is really difficult to test and you are collecting only a few samples. And so you have a very, you have a high false sense of security. So I would say reach out because again, it is so product and process and facility specific, but there's guidance documents, right? So guidance documents from specific societies or associations if you're working with dairy, if you're working with nuts, if you're working with meat and poultry, right? So there's also those very specific resources.
Yeah, and here also arrived the clarification of previous question. So we use the definition of OPRP, that these are PRPs that are identified as a part of hazard mitigation within the decision-making tree. All PRPs have higher prioritization in PRPs monitoring and verification.
Yeah, yeah. So, again, if you are going to rely on those for managing hazards that carry a relatively low level of risk, those OPRPs still need to be validated. They still need to be monitored, right? And you still have to have corrective actions associated with that, because at the end of the day, you are trying to manage the risk associated with the hazard using those operational PRPs or OPRPs. So they still have to be validated, right? At the end, typically the way that I tell people is, and I think I said this in my presentation, we over rely on prerequisite programs, and not most of the time, but many times, those prerequisite programs are not adequately validated. So then at the end of the day, we're not managing the risk effectively.
Yeah, and also maybe a very simple question from my side, but still I found it quite interesting that a lot of experts in HACCP and hazard risk analysis, they really highlight the hazard identification and risk assessment like you did today. And where do you most often see companies confusing these two terms in practice?
Yeah, I mean, I think I see them all the time because people say that they did a risk assessment, and this is and so that risk assessment is typically some kind of risk scoring or risk ranking, and then they will call that their hazard analysis. But their hazard analysis is much more than that, right? The risk assessment, it's a tool that they can certainly use to support their decision making, and companies will have risk assessments that they have done internally, right, based on history, on testing, and whatnot. Most small and medium companies don't have the capacity or the data to do those things. And also, the risk assessments are very specific, right? So if they make it quantitative, they're very, very specific and not particularly applicable. Now, we do have a lack of tools that the general industry can use to do risk assessments. And the risk assessments that we have are typically at the policy level or at the government level, and it doesn't really trickle down into practice for risk management, right? So, so I think that we need to be careful with that. If you do say that you're doing a risk assessment, you can, I would suggest to call that just a risk ranking or a risk scoring that you're using to support your hazard analysis.
Thank you. Thank you. And the next question, I'm sure that you will love it because it's so technical.
We'll see.
Yeah, there are microorganisms that produce toxins such as Staphylococcus aureus and Clostridium botulinum.
Mm-hmm.
I'm sorry if I pronounce it wrong. In a HACCP plan, should the microorganism that cause the toxin be classified as a biological hazard, or the toxin produced by this microorganism as a chemical hazard?
Yeah, that's a great question. And historically, we have considered those to be biological hazards, even though it's the toxin in the case of Clostridium botulinum, or in the case of Staph aureus, or in the case of Bacillus cereus, even though it's the toxin that it's actually preformed in foods that it's making people sick. It comes from a live organism, right? So we have historically deemed those as biological hazards versus other types of toxins like mycotoxins, right? So it's just by historical convention. So I would advise just stick to it. Yeah.
Yeah. There is another comment, not really question, but just comment. In Canada, we have the technology assess centers, which were built in a similar line to the state extension service. Niagara College, where I am, and I act like a state extension specialist, minus the title.
Yeah, so I know who made this comment, and that's great. That is great because I think, whatever we call it, of course, the extension system in the US, I'm a strong proponent because I'm an extension specialist, right? So a lot of my salary comes from the extension line. But we certainly have a huge role in supporting local emerging industries and connecting research to the public. So yeah. So if this is Amy, yeah, keep doing the work. It's amazing. Yeah.
Yes, yes. Another question. I think we still have time for it. What are the common hazards by producing pre-cooked cassava fries, grated and safe chunks?
Yeah, well, microbiologically speaking, you could have, if the product is dry, then salmonella will be a hazard reasonably likely to happen. You could also have spores, depending on the way that that product was produced, and GMPs. From a chemicals perspective, you could also have mycotoxin residue, right? Cassava production. I was actually very lucky to go to Ghana a couple of years ago and really see how cassava flour and fermented cassava products were produced. And so again, context matters. If you're slicing and grating and whatnot, then you can have physical hazards certainly introduced there. So GMPs are particularly important, especially if the product is going to be ready to eat. Yeah.
Thank you. And I would honestly ask you, Byron, maybe somehow to summarize our session today,
Mhm.
like the key, maybe top 3 points would you highlight for today's attendees to take out of this session?
Yeah, well, let me see if I can remember what I said in the last hour. But yeah, I think the over reliance on prerequisite programs is an issue because those prerequisite programs are intended to manage risks of hazards that we have identified, but tend to not be validated, right? So that's one. Have validated prerequisite programs if you want your HACCP system to actually work. Secondly, assess hazards from an ingredient perspective and then from a process perspective without, with special considerations to recontamination, cross-contamination, and rework, right, that people typically forget, introduction of hazards through rework. And then the last one would be consider all the sources of where your ingredients are coming from. We see many instances in which geographical location actually matters, like the example that I gave with radiological hazards, that up until last year, we didn't have any issues with radiological hazards in the US, and then we saw radioactive shrimp for a number of months. Now the shrimp was not radioactive; it just had some detectable level of cesium. But geographical location matters, and if you change suppliers, let's say from location A to location B, you have to really be aware of the environmental context of that location B.
Thank you so much, Byron. And thanks to everyone who was super active today. And I hope you really enjoyed our session. We don't say goodbye to Byron because we see him in May already. And those lucky ones who submitted to his course will see him as well. And I do invite you already to our next webinar in March. And I see you all request, no worries. I will respond you within the next couple of minutes with the slide deck from Byron. And what can I say? Just wishing you a lovely evening and a great morning if you are at the morning time zone. So have a nice day and evening to everyone and see you next time. Bye-bye.
Thanks, everybody. Bye.